What supportive measures besides medicines can help bring fever down? Supportive measures you can do along with giving medication. One is to increase the fluid intake or the water intake of your child. And the next one, which everyone knows, is the tepid sponging. You sponge your baby to bring the temperature down. So here if you look at, how do you sponge your baby? The word is tepid. Tepid means lukewarm. Why it's important is a lot of people use cold water and ice to bring down the temperature. This is not advisable. Use water which is lukewarm. So now the question, how is it working if you are going to use lukewarm water? This principle is the water is placed on your body surface is evaporating using the temperature from your body. So all of you know, energy needed for the water to boil is less than the energy needed to convert water to water vapor. So your purpose is to use this heat of conversion, which is a very high, which is 540 calories, to bring down the temperature. Now, when you use a cold water, the baby starts feeling very uncomfortable. Babies will cry, they will shiver and all that. So when you use the body temperature water, which is lukewarm, it is comfortable for the baby, and from that temperature to evaporate is easier than for a cold water to evaporate. So this is the principle. The word itself means tepid, which is lukewarm. So make sure, and again you should make sure as much area of the body should be wiped, because the larger the surface area, the earlier the temperature will drop. Now the way to do it is you take a towel or a sponge, dip it in water and wipe the whole body. Wait till the water evaporates to wipe next. This cycle should follow till you can control the temperature. So often when you find the fever is high, you have given the medication, sponge till you wait for the medicines to take effect, which usually should come in about 30 minutes to 1 hour. You should start finding the effect of the medicine. Often parents do complain, why do I find the head is very, very hot in babies? So you should understand, if you look at a baby less than 1 year or so, you find that the head size is comparatively larger than the body. There's a lot of blood circulation into the brain or the head during this age. So you will find that there is a lot of warmth dissipated from this area. Sometimes you find that the body is very hot but the hands and feet are very cold. This usually means that the fever is very, very high. If the whole body, the legs and the hands and the body is all warm, usually the temperature will be lesser than when it, like if you have a 40-degree temperature, most likely the peripheries will be very cold and the center will be very, very hot. So these are some ways to understand whether your child is having higher fever or a smaller fever. Also, look in your baby whether there are some rashes. There are a lot of viral infections where when the fever settles, you start getting a rash, which we call like the measles-like rash. They are usually just viral rashes and will settle down in 2 to 3 days' time. The fever, high fever along with rashes need to be checked for. There may be bacterial infection, sometimes you need antibiotics. Those things need to be looked into. This is to give you an idea about how to manage when you face a child with a fever at home. This is not a substitute for medical assessment and proper treatment. I am only trying to tell you, no need to run to an emergency just at the onset of fever, how to manage in those situations. Hope this will be useful for you.